there. My name is Dr. Matt. Very nice to meet you. I'm going to do your examination. Can you please verify your first and last name and your date of birth? Okay. And I see here that you are not the first time in this clinic, but it is the first time that I'm seeing you. So I would really love to go over your medical history and make sure that I have all the information. Can you please verify your allergies? Okay. Are you taking any medicine on a daily basis? And how many milligrams of that? Is that BID? Okay. Any medical history of hypertension? Okay. Asthma? Okay. Any digestive disorders? Are you experiencing any neuromuscular problems? Okay. And are you having any pain right now? On a scale of 0 to 10, 0 being no pain, 10 is the worst pain that you've experienced, which level would you say you are? Okay. Are you experiencing any headaches? Sometimes. And how often are they? Okay. Would you say that they are generalized more in the front or in the posterior side? Do you have any neck problems? Are you experiencing any pain when you're moving your head left, right, up or down? Okay. Good. Are you experiencing any difficulty breathing? Okay. And do you feel any skipped beats in your heart? Would you say that when you're resting, your pulse is very high, your heart is beating very fast, or is it very slow? Okay. Are you experiencing any vivid dreams? And how often are they? Do you wake up in the middle of the night sweating? And do you wake up in the middle of the night and can't go back to sleep? Do you have any surgeries in the last 6 to 10 years? Okay. And any head injuries or any other injuries or accidents? Okay. All right. It looks like I have everything that I need. I'm gonna go ahead and put some gloves on and we'll do your vital signs. first I'm going to take your temperature. This is going to go sublingual. So I'm going to have you open your mouth, and I'm going to put this under your tongue, and we're just going to hold it there for a few seconds. Did you have anything to drink before you came in? Okay. .1. It is a little bit elevated, but let's go ahead and continue. I'm going to put this on your index finger. Okay, I'm going to have you relax. Take a deep breath in. And breathe out. Good. Heart rate is 105. Oxygenation is 98% on room air. I would say that your heart rate is a little bit elevated. We're just going to have to check. So I'm going to put this on your upper arm. Is your left arm okay? Okay. So let's go ahead and then just give this side of the arm a little bit of a squeeze. Good. And we will be taking a manual blood pressure. Okay. Can you please uncross your legs for me? Thank you. Blood pressure is 107/60. We're going to go ahead and just slide this cuff down. Very good. Okay. And I'm going to listen to your heart and your lungs. Is it okay if I slide the stethoscope under your shirt? Thank you. Go ahead and breathe normal for me. Okay. I can hear only S1 and S2. No S3, no S4. We're going to go ahead and listen with the bell. Now we're looking for murmurs, which would indicate a lot of conditions, one of them being atrial fibrillation, something that if it's caught early, we can definitely treat it. Okay. Can you take a deep breath in and hold it for 1, 2, 3, and breathe out? Very good. I was not able to hear any murmurs, which is a very good indication of heart health. Let's go ahead and check your lungs. Can you please take a deep breath in and exhale? side. Take a deep breath in and exhale. Very good. And listen to your sides as well. Go ahead and take a deep breath in and exhale. Very good. And we'll do that one more time. Take a deep breath in and exhale. Perfect. Okay. I was not able to hear any abnormal breath sounds. Heart rate is also equalized. I'm going to just write down your vital signs to make sure that we have them for the nurse. And also for, medical records. Of blood pressure, heart rate, temperature, and oxygenation. 99% on room air. Are you experiencing any chest pain right now? Okay. I'm going to start by checking your face and your head. Okay, go ahead and tell me if you feel this on the left or right. I'm gonna have you close your eyes. Perfect. So go ahead and tell me if you feel this on the left or right. Okay, what about now? Good, and now? Okay, and now? Okay, and now? Alright. What about here? And here. And did you feel that equally on both sides? Okay, very good. I'm going to palpate your face. Let me know if you feel any kind of pain. We're looking for any swelling. So we're palpating sinuses above the eyebrows. Good. And right under your eyes. I'm not feeling anything. I'm going to go ahead and slowly palpate your lymph nodes. Let me know if you feel any kind of pain as I'm doing this. Any pain here? Okay. And just palpating your submental lymph nodes right under your chin. Good. Going down the neckline. And supraclavicular lymph nodes. Good, I'm not feeling anything swollen, so no signs of lymphadenopathy. Good. I'm going to check your strength now. Go ahead and place your palm in front of you. Very good. I'm going to place an object in your hand. Go ahead and try to squeeze it, okay? Alright, squeeze it. Very good. And now it's the same thing on your other side. So left palm up for me, please. Go ahead and be ready. I'm going to place this on your palm. and squeeze it. Good. Okay. Now we'll do this simultaneously. So I'm going to put 2 fingers on each palm, and I'm going to need you to squeeze my fingers. Very good. Alright, let's go ahead and do some movements with your head. So we're checking for upper body strength now. Go ahead and try to move your head this way. I'm gonna push you the opposite direction. I need you to resist me pushing you. Okay. 1, 2, 3. Good. And we'll do the same thing on the other side. So I'm gonna need you to resist. Good. Alright, go ahead and lift your shoulders up. Shrug your shoulders. Good. Alright. And now I'm going to have you put your arms in front of you, just like that. I'm going to try to push them down. Don't let me do that. Good. And I'm going to try to push them up now. Don't let me do that. Very good. I'm going to try to open them. Don't let me do that. Good. Now I'm going to try to close them. Don't let me do that. I was able to notice that you're not wearing any contacts, but do you have a prescription for glasses? Okay. Go ahead and look straight in my nose. I'm going to flash a light in your eyes. We're checking for pupil dilation and constriction. Alright, go ahead and focus on my nose. Good. Focus on my nose. Perfect. Okay. I'm going to place my palm right next to the side of your face right here. I'm gonna need you to look right over here. Good. Keep on looking there. Very good. And we'll do the same thing on the other side now. Keep on looking here. Okay. There's no rhythmic changes. I'm going to go ahead and lower your eyelid. And on the other side. Okay. A little bit of redness. Let's go ahead and check your peripheral vision. I'm going to have you cover one eye. We'll both do the same thing since we are on the same height. So I'm going to need you to tell me when you don't see my fingers in your field of vision. Now. 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 And let's go ahead and switch eyes. Now. 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 Okay. Next, I'm going to ask you to tell me which fingers are moving, my right or left, or you can use your left and right. I will definitely be able to understand that. All right. Good. Okay. Good. Good. Okay. Good. 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 You can see that. What about now? Okay. Now. Good. Good. Alright, I'm gonna have you follow the light with your eyes only. Don't move your head, okay? Alright, and now we're gonna use the bright light to do the same thing. Go ahead and follow the light. Okay. I'm going to check your optic nerve. So for this, I'm going to ask you to look straight behind me at the wall. I'm going to come very close to your eye and visualize behind the retina. So go ahead and look behind, straight at the wall. Good. Keep on looking. Good. Try to focus behind me. I'm seeing a little bit of redness. Do you suffer from floaters? On which side? Okay, definitely I can see that in the right eye. Okay. Alright. We're gonna do the same thing now on the other side. Focus on the wall behind. I believe you do have some scratches here as well, and you might be experiencing floaters on both sides. Okay. I'm going to use the Snellen chart to assess your visual acuity. Alright. Can you please tell me what letter this is? Okay. And can you read this row for me? Okay, very good. Alright. So I'm gonna go ahead and continue. What about this one? Okay, good. Can you go ahead and read this letter? Alright. And can you see this row? Just try to do your best and tell me if you can read any of the letters. Good. It's getting kind of blurry. Okay. Alright. Okay. No worries, you're doing great. Okay. So you do have a little bit of problems there, but that just might mean that you do need a new prescription. Okay, go ahead and tell me when you see a ball in your field of vision. Now, and what color do you see? Very good. Alright, go ahead and tell me when you see it again. Alright, good. Tell me when you see it again. And okay, tell me when you see it in your field of vision. Very good. Alright. I'm going to check your facial sensation now. I'm going to ask you to close your eyes. Okay? And I'm going to create a puff of air and place it somewhere on your face. Can you please tell me where you feel this? Good. And now? And now. Good. Keep your eyes closed. Good. Okay. Everything looks good. I'm going to touch you with two textures now. One is going to feel dull. This is what dull is going to feel like. I'm going to show you in just a second. Okay. And this is what sharp is going to feel like. Okay. So go ahead and tell me if you feel this sharp or dull. Keep your eyes closed for me. Thank you. Dull. Sharp. Dull. 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 Does this feel sharp? And does this feel sharp? Okay. We'll continue. Okay. Dull. Dull. Very good. Does this feel cold or warm? Warm. And does this feel cold or warm? Cold. What about now? Good. And now? Good. I have a few more tests that I would really like to test your temperature sensation. Go ahead and tell me if you feel this on the left or right. Good. And now. Okay. Alright. What about now? And now. Good. Okay. Good. Perfect. Okay. Moving down the body, on the neckline. Okay. Now I'm going to need you to tell me if you feel this cold or warm. Cold. 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 Oh, right. Please go ahead. Keep your eyes closed. I'm going to draw some letters either on the forehead or the cheeks. So I'm going to need you to tell me what letter I'm drawing, okay? Good. What about now? Okay. And now? All right. That sounds good. Have you noticed anything abnormal with your taste? The coffee in the morning tastes a little bit muddy. Okay. Is that unusual for you? Alright, we're definitely gonna go ahead and examine that. Go ahead and stick your tongue out for me. Alright, now say ah. Good. Okay. Well, I don't see anything abnormal, but I would like to check your taste. I'm just gonna go ahead and bring this a little bit closer to me so that I don't have to lean over you so much. I'm going to put a piece of paper on your tongue, and I'm gonna need you to try to analyze it and tell me what it tastes like, okay? Okay, what does that taste like? Nothing, just a piece of paper. Alright, that sounds about right. Let's go ahead and try one more. Okay, what does this taste like? Lemon. Alright. One more. Cinnamon. I don't know why I put it back. Okay. And one last one. One last taste. Alright, go ahead and open your mouth. What does that taste like? Lavender. I love the taste of lavender, especially in coffee. Okay. And are you experiencing any nose bleeding? Any changes with your smell? No? Okay. Well, that's a good sign. So that means that anatomically might be everything in order. We're just gonna go ahead and take a look inside your nose just to make sure that there is nothing abnormal. Okay. Alright, I'm gonna have you look that way for me. Thank you. Okay. There's no fluid discharge, and the tympanic membrane is normal color. Go ahead and turn your head the other way now. Thank you. Okay. But I would say overall the health of the tympanic membrane is not compromised. Okay. And let's go ahead and check your nose as well. We're just going to switch the head of the otoscope here. Okay. Can you please look up for me? let's go ahead and check your smell. I'm going to take a look inside here. Both sides. No David septum. Do you have any concerns for me? Okay. I do have here a package, and we're going to evaluate your smell. Make sure that the olfactory nerve is intact. Can you please close your eyes? Good. And what does this smell like? Just take a deep breath in through your nose and out through your mouth. If you need a moment to think about it, you can. Alright. Yes, that was garlic. I know it's not a very pleasant smell, but I usually like to start with that one just to get it out of the way, and then we have more pleasant smells as well. Okay, so I'll do the same thing. I'll have you breathe in through your nose and out through your mouth. Very good. Smells like parsley. Okay. I love fresh herbs. I use them a lot when I cook. Right. I'm gonna try one more. Go ahead and take a deep breath in through your nose and out through your mouth. Good. What does that smell like? Coffee beans. Excellent. Okay, I do have one more. Go ahead and take a deep breath in through your nose and out through your mouth. If you need a moment, you can definitely think about it. Lavender, my favorite. I love it in coffee. I know I keep on saying that every time. Right, I'm gonna go ahead and put this back in. Since you have your eyes closed, I'm going to go ahead and check your hearing. We're going to create a vibration sound with a tuning fork. I'm gonna need you to tell me when you don't hear the sound anymore. Now, good, and we'll do that one more time. Go ahead and tell me when you don't hear the sound anymore. Now, alright. Can you please tell me if you'll hear a high pitch or a low pitch? I have here 2 tuning forks. Alright, so this is 1 and 2. Which one is higher? 1 or 2? Okay, let's go ahead and try that again. Which one is higher? 1 or 2? 1 or 2. Alright, and we're going to switch the position one more time. Which one is higher? 1 or 2? Okay, very good. Now can you go ahead and tell me which position here is louder? Position number 1 or 2? 2. Position number 1 or 2? 1. Okay. Are you experiencing any hyperflexibility or hypoflexibility? Okay. Any sudden movements? Sometimes. Alright. I'm going to go ahead and just slowly tap on your lower jaw. Let me know if you feel any kind of pain. I'm going to have you relax it a little bit more. Lower your jaw. Good. And I'll continue down your body to check your reflexes. Okay. So we're looking for muscle movement. Good. Okay. Same thing on the other side. Okay. Okay. Alright, and I'm going to have you relax your legs as well. We're going to check your patellar reflexes. Good. Okay. I do have some concerns. It doesn't look like it's anything serious, but I would like to perform a little bit more tests, something in detail, to make sure that neurologically everything is intact. So we're going to order an MRI of the head and neck. I haven't had a chance to check your neck yet, but I suspect that if there is something, it's internally. Now, cranial nerve 3 and 4 were a little bit off. The tests were inconclusive, so we're going to go ahead and check that MRI and we'll call you back with the results. Is that okay? Alright. Do you have any questions for me before we leave? Okay, perfect. Well, it was a pleasure to take care of you and do this exam. I'm going to go ahead and step outside and let you get dressed, okay? Nice to meet you.